Hi guys, today we will be learning about one of the important chapter, which is chapter number 15 related to pregnancy. All the codes which is related to pregnancy, no matter whether it is preterm, postterm or prolonged, whether it is in trimester, before delivery, after delivery, everything we'll be learning step by step. We have different terminologies in pregnancy. We'll be learning all those terminologies today. And what are the codes we need to assign? We will be learning the step-by-step guidelines which we have as per standards. Without any delay, let's start the guidelines which were there in this chapter of pregnancy. Here, all the guidelines which are related to before delivery, during delivery, after delivery. But we have certain time frame. We will be looking into that time frame and we'll be assigning. Ensure that we have supporting physician documents for that. Without any delay, let's start with our first guidelines, which are general rules in order to assign any kind of pregnancy chart. The general rules in order to assign any kind of pregnancy charts. First, start with the sequencing of this chapter codes. Chapter number 15, pregnancy code series, starts with O. Now, as I have mentioned in most of the chapters or all of the chapters, stating that in pregnancy we have separate code category starts with O, whereas this pregnancy includes and involves all the system which we have in our body, right? So with this mindset, let's remember, whenever you are coding any pregnancy chart, O series should be assigned, and that O series should be your principal diagnosis followed by other conditions. What does O series first followed by other conditions? We'll be learning in detail step by step. Just wait for a few more minutes. We'll be learning many guidelines which are related to this pregnancy charts. Next guideline is absolutely for you, because you have an intention to learn medical coding, because no one teaches in depth about pregnancy. Just they will state that for all the pregnancy charts the codes are similar, but just you need to focus the codes which starts with O series. But based on my key learnings, I will be sharing the most practical examples or practical words or documents or the statements which you will be encountering when you are coding any pregnancy charts. Let's start with here. First, we have discussed whenever we are coding these chapter codes or pregnancy charts, we'll be coding from O series, and if we have any further description, that code will be followed by second code. Next, here, as you all know that the code series codes characters are from 3 to minimum of 3, maximum is 7, right? So here the seventh character states something. Before that, in pregnancy you need to learn about sixth character. In most of the charts we have all the characters, but in pregnancy chart we need to focus sixth character as well as seventh character. Few codes we have sixth character, few codes will be having seventh character. First, focus with sixth character. Sixth character in pregnancy indicates trimester. What does trimester mean? Trimester means the days or weeks until the day of delivery considered as trimester. Before delivery, it is considered as 3 trimesters. We have 3 trimesters: first trimester, second trimester, third trimester. But we have certain durations or we have certain days which we need to consider as first, second as well as third. First trimester is 14 weeks 0 days. Less than 14 weeks or till 14 days 0 days, 14 weeks 0 days considered as first trimester. From 14 weeks to 28 weeks considered as second trimester. From 28 weeks till the day of delivery considered as third trimester. Remember one thing, whenever you're coding the sixth character as trimester 1, 2 or 3, remember these codes we need to code before delivery. Consider as antepartum. Before delivery, consider as antepartum. Once the patient gave birth to child, we will not code these trimesters. We will not code these trimesters. And here I would like to give one tip for you. Here I would like to give one tip based on the code series. Based on the code series. Here you have seen the sixth character, right? Whenever you are assigning these codes, trimester 1, 2, 3, remember to code weeks of gestation. Weeks of gestation. The code series starts with Z3A. The code series starts with Z3A. Remember, whenever you are coding pregnancy charts, you need to code this code as well, which gives an impression to the physician, an impression to whoever reviewing the chart. Yes, the patient is at these weeks of gestation. This is how you need to train your mind to assign weeks as well. This is before delivery. After delivery, we have some other things we'll be learning in detail, step by step. But first, focus on this. Whenever you are coding pregnancy chart, that code should be first, followed by other condition, and that code series starts with O. And if we have any trimesters mentioned by the physician, we'll be going 1, 2, 3 trimesters, and based on the days and based on the physician documents, we'll be going accordingly. That would be for sixth character. And as I mentioned, we need to capture the gestational weeks as well. Gestational weeks as well. For example, if a patient is admitted to the hospital at 13th week, that means trimester 1, and patient had some anemia, they have treated with that iron tablets or infusion of iron, infusion of ferrous, they have treated. Patient discharged at 15th week, that means trimester 2. Admitted in trimester 1, discharged at trimester 2. Do we need to assign sixth character as trimester 1 or trimester 2? What we need to assign? Just think, I will be giving 5 seconds. 1, 2, 3, 4 and 5. If your answer is we need to go with trimester 2, listen carefully. We need to assign trimester 1. Whatever might be the situation, whatever might be the guideline, whatever might be the condition, ensure that whenever the patient admits to the hospital, that day should be considered in order to calculate any time frame. Whether it might be for pregnancy, it might be for newborn, it might be for MI, it might be for any other conditions which has time frame. Let's take for newborn, we have 28 or 29 days, but it should be calculated based on admission date. Admission date should be the time frame date, not discharge date, because as I mentioned, if a patient admitted to the hospital in trimester 1 and discharged in trimester 2, don't assign this trimester 2 code. Assign trimester 1 because it is there during admission. And you might be having a question, if trimester was not mentioned, let's take some unspecified. Nowhere it is mentioned as the gestation weeks or trimester. You can check with the physician. If nothing is there, we'll be using very rarely this condition. Very rarely we'll be taking unspecified trimester, because if a pregnant patient is coming to the hospital, definitely the gestation weeks should be there. If it is not there in current visit, go back and check in previous visit, because every month or every 15 days they will be visiting to the hospital to check the status of the baby as well as the mother, right? So that's the reason whenever you encounter stating that no trimester in your documentation, go back and check previous visit. There might be something there, right? So go back and check that document, you will be having a better picture. But if nothing is mentioned, no problem, you can go with unspecified, but this should be used very rarely until you have a specific client guideline stating that we should not use. Now We'll discuss about seventh character in pregnancy when we have single baby as well as twin baby or triplet or quadruplet, whatever it might be. If let's take an example. Here is the patient with 37 weeks of gestation, and as per report it states twins, and twin fetus A affected with anemia and fetus B is good. Fetus 2 is good and fetus 1 is affected with anemia. While assigning the code, we need to differentiate fetus 1 as well as fetus 2, because fetus 2 is healthy but fetus 1 is affected with anemia. So here you need to focus how to differentiate that. This seventh character helps you a lot. This seventh character helps you a lot. If there is only one fetus in that mother womb, we will be going with 0 as seventh character, 0 as seventh character. But if we have 2, 3, 4, 5 or more than that, in that case we will be assigning the seventh character 1, 2, 3, 4, 5 until 5 childs. If more than 5, we will be assigning as other unspecified. For fetus, we have for multiple gestation or multiple babies in mother womb, we will be coding the seventh character as 1, seventh character as 2, seventh character as 3, 4, 5 and other. How you need to code? If the fetus 2 is affected, you need to assign the code for fetus 2. If the fetus 3 is assigned, go with fetus 3. The seventh characters differentiate from 0 for single, 1 for 2, 3, 4, 5, like that. This is how the seventh character helps you. Let me give an example. If a patient has 3 fetus in her womb and the patient came for delivery and one of the fetus has some malpresentation, that means baby presentation was not appropriate, because we have 3 fetus, definitely there will be some disturbance on regular cephalic presentation, right? So there is a malpresentation of, let's take breech presentation of fetus 3. So whenever you are assigning this breech presentation for fetus 3, you need to assign breech presentation and you need to segregate whether that is delivered or not. We will be learning how to segregate whether the patient or the pregnant woman has delivered in this visit or not. How we need to code before, how we need to code during, how we need to code after. Now we have learnt how we need to code before. Before means antepartum, we will be coding trimesters. Before coding or before delivery, we will be coding trimesters like 0 to 14 days, 14 to 28, 28 to the day delivery considered as a trimester 1, 2, 3. And this would be for 6th character. And for 7th character, if there is multiple gestation, multiple babies or multiple fetus in mother womb, then we'll be coding the 7th characters appropriately. As I mentioned, 0 is for single and 1, 2, 3, 4, 5 and other respectively, which differentiates fetus 1, fetus 2, fetus 3, fetus 4, like that, so on. So this is how we need to code whenever we have a patient without delivery. That means before, there will be regular follow-ups, right? During these follow-ups, we will be coding like this. Next, we will be learning how to assign the codes of pregnancy, how to select the first listed code, how to select the second listed code, followed by everything we will be learning in next video. Stay tuned to the next video. Until then, keep practicing.